Hi, welcome back to Rohrich Knows Podcast. Well, we're going to take a deep dive into injectables and neuromodulators today. Everybody wants to look their best, and they want to do it not only to looking their best, but getting the best treatment possible. So that's why I have Dr. Clifton here from Bentonville, Arkansas. Missy, welcome. And so we're going to take a deep dive into injectables and what's best for you in every phase of your life. So Missy, tell us a little bit about how you manage patients, especially when they come in their late teens, early 20s, and they say, you know what, I've heard about, they've been on TikTok, and they say, I've heard about Botox, and you don't see a line on their face. So what do you tell these patients?
So I usually start with, you know what, you look fantastic, and I love that you're here early. Because I do feel like that this younger generation is so far ahead of the game compared to where my generation was. We weren't even thinking about this kind of stuff. We were still laying out in the sun and being really idiots at their age back in the day. So I admire the heck out of that, and I'm glad they're here. So I tell them, you know what, you look perfect. So our goal is to really prevent. Right. Okay. And so I talk to them a lot about good skincare.
Right.
I talk to them a lot about really protecting themselves from the sun, maybe starting a little retinol containing product, maybe starting some antioxidants and things to really, in addition to sunscreen, kind of reverse a little bit of the damage that maybe they've caused.
In their teens?
And in some cases.
In the teens, you'll get them on a retinol, you think? Really?
I am not scared because most of these kids and youngsters do have a little bit of acne as well.
Oh, yeah.
So, acne also is treated, with retinoids.
Sure.
So, I don't necessarily start them on anything very strong,
Sure.
But just getting them started on something, especially if they have a little bit of acne and they're wanting to do some preventative work, there's nothing negative about doing a retinoid maybe even 2 or 3 times a week at night.
Okay.
You don't necessarily have to start hardcore with the big guns, but that's something I do talk to them about. And there are a lot of young women and sometimes young men as well who are really ahead of the game that are coming in, and they are starting to see the wrinkles in the areas where they make facial expressions, and some of it's genetically are born. With a frown. Some of us, we use certain muscles of our face more. And so I do treat with very low dose neurotoxin in a lot of these young people who are starting to already get etched in lines in their skin from wrinkles due to muscle movement. Not a lot, but some. Right. I do have some young people who come in with very pronounced facial asymmetry that is more genetic, or maybe it's happened after some sort of trauma or some sort of, car accident or something like that. And so in those people who have, really, it's pronounced that something is not symmetric on the sides of their face. Sometimes we do resurfacing, laser resurfacing or fillers in those patients fairly early on to kind of help give them a boost. But the vast majority of the time when it's these younger people, it's really just education on how to prevent damage and how to start reversing some of the damage.
Yep. I think that's good advice, because I sometimes see on TikTok these tweeners that are actually like going to Sephora and they have all this array of incredibly expensive skincare, and they don't need 95% of that. They need sunscreen, and I think you're right. If they have acne, they need some retinols and stuff like that. But boy, they really pile it on, right? I mean, it's unbelievable.
Yes, I have a 17-year-old daughter, so I battle with her. I'm a board-certified dermatologist. I'm board-certified in laser surgery, but I'm a moron.
Of course,
TikTok knows more than me.
You're right, because I believe me, I have a daughter too, and until they're 21, 22, you don't know anything, as you know. But
that's right. My 23-year-old now does think that I have some mental capacity now, so that's good. It does kind of come back around.
Yes. Yeah, there is hope. My 24-year-old son thinks I'm okay now, too. I know. That's funny.
But there is so much. And, social media is so difficult.
It
would be really hard to be a teenager in this day and age because, gosh, we got away with a lot of things back in the day because we weren't documented doing them on social media.
Right.
So it's a lot of pressure for these teenagers, and they're constantly being recorded and photographed. And so I get why they want to look their best. But the key is to not spend a lot of money on a bunch of junk.
Right.
And do things that are going to cause no harm, but also ease them into this great preventative concept that they're very, very into already.
Right. I like that. Prevention, education, and don't do crazy stuff and don't do any harm. That's going to affect you adversely. So, okay, let's fast forward now. Patients, normally coming in their 30s, and, they're saying, hey, what do I need? Missy, what do I need for my face? And they've got some fine wrinkles, and of course, we'll just talk injectables today about this. So, but, time for Botox, time for fillers. I mean, in their 30s, where do you think they can get their biggest bang for their buck to look their best? I mean, obviously, and we're going to skincare aside, for neuromodulators and injectables?
So I will say almost everyone in their 20s and late 20s, 30s into their early 40s, you're going to have some collagen loss.
Sure.
That collagen loss starts in your 20s. If you've had a lot of sun damage and things like that, like most girls in Arkansas have, you're going to have some wrinkles in areas where muscle movement is causing it, in the crow's feet, the glabella. So it's prime time to start a neuromodulator.
I agree.
And I really recommend that women start those before they have the etched in kind of permanent lines at wrist. If you already have a permanent line at wrist, if you do the neuromodulator and you really keep coming in every 3-4 months, and we're really correcting that muscle movement that's causing it, you can reverse even some moderate lines and wrinkles with neuromodulators. So I just recommend we get started on that, like you said, also with skincare. And then a lot of women are starting to really see a little bit of volume loss. Sometimes it's in the lateral cheek that we first see it. Sometimes it's in the perioral region around the mouth. So lip fillers are very, very, very popular in young women even. Everybody wants nice plump lips. I'm anti the lips that enter the room before you. I don't want them to be so big that they don't look beautiful, and they need to be in proportion to your face. My goal is always for it to look natural, and for it to look like, you've had nothing done. You just look beautiful and well rested, and people cannot figure out what's happening. And so I don't like to over neurotox people. I don't like to give you the inability to make facial expressions completely. And I don't like to overfill. So my goal is when people come in and they're really new to Botox or neurotoxins and fillers, is to start slow. Take some really good before pictures, look at, here's what we're addressing. I usually get them back very quickly within a few weeks when it's their first treatment, and really say, okay, this is what we see. How are we feeling about that?
Right.
And, if we need a little more, a little tweak, that's great. But the goal with this younger population is really to not overdo it, and to make it look really natural and really be more of a prevention than a true treatment.
Yep. No, I agree. Less is more. And then, in most of my patients, I'm like you. I'll totally underdo it, because I'll do about half of what they want, and then also let's take a look at it, especially like on lips and things like that, because overdone lips, they just totally negate somebody's beauty. And so I think less is more, and then just let's follow them and just see how they look, and I think that's good. And I think when do you start doing temples? Because I'm a big believer in going from upper to outer to lower, because sometimes the temples give it all away, and people have all these incredible cheeks, and they said, well, you know what, you forgot your temples, and if you do this too much, you'll look like a peanut. Not that peanuts are bad.
The peanut head Yeah, the peanut head look is really not what we're looking for.
No.
You know, where you're hollow here and big
Right,
here
yeah.
and hollow here.
But
Not good.
people don't
So
understand.
I will tell you, of course, in Arkansas, because it is warm a lot of the year, there's a lot of cyclists and a lot of runners and a lot of, triathletes. So I see a lot of people who are very, very fit.
Right.
And if you're very, very fit, you really don't have a lot of fat in your face a lot of times. So a lot of those people, you're going to start to really see the hollowing in the temple, the hollowing in this kind of, submalar area. They just start to look gaunt. And in those people, I will do filler fairly early, or even stimulators that will help to rebuild their own collagen naturally. So I'll do that a lot of times, even in the 30s and early 40s. If those are my really hardcore working out people, if you don't do that structural support, everything else is going to fall apart over time.
Yep.
So you do have to kind of rebuild and maintain as they lose that volume.
Yep, I agree. In fact, those areas, if you just do a modest amount, because those are some of the areas where you lose the fat earliest, and you lose the muscle in the temple because it's a skeletal muscle. If you just do a little, it actually makes your cheeks look so much better. So I think that's kind of if you understand the aesthetics, which obviously you do, adding temple filling here and just a small amount actually gives you a beautiful oval face back and gets rid of the peanut. And it obviates the need for a lot of the other stuff I see. Like I just took out so much filler on a patient from California that had just her fillers all here, and she had the peanut look, and so I'm going to melt it out first, and I have to totally redo it. So, go to an injector like you that understands facial aging and doesn't, trade one distortion for another.
Unfortunately, there are a lot of people out there that don't have a lot of understanding of facial anatomy and what actually happens to the fat pads and the muscles and the bony structure of the face. And so they inject in the wrong place, or they inject the product in the wrong place. And it ends up looking very fake and very unnatural, especially when they're making facial expressions.
I know.
It can look very freaky. So yes, we do a lot of dissolving and kind of erasing what's been done and then starting fresh. So yeah, you're right. It is key to go to someone that really has a great aesthetic eye, in addition to really good experience and good, foundational understanding of anatomy.
Yep. So when you tell your patients, you know what, you're done, you need a facelift, what's your goal for that? I'll share with you.
So when patients come in and, they just have a ton of skin laxity that's just literally hanging, and I can try to lift and pull where I would naturally put filler, and I see no difference. I'm like, listen, honey, I think you're beautiful, but I am not going to be able to fix, what's happening here with Botox and filler. And I'm doing you a disservice if I tell you that I can. So, you need a facelift, you need a neck lift, you need a tummy tuck. And, I just tell them, I say, this is what happens, with hormone loss, with sun damage, with having babies, with stress, with all of the things. It's not your fault, but we can't fix everything with Botox and filler.
Right.
And sometimes you just need to go see our favorite plastic surgeon, Dr. Rohrich, and get all fixed up.
Yeah, no, I agree, and I think the biggest thing is, and great dermatologists, like you said, exactly the right thing. And once you see significant jowling, if you chase the jowling, then all of a sudden you'll get that, totally, Stay Puft Marshmallow look, and that looks terrible. And it just
you don't want your patients to look like a puffer fish.
No, and people in the past would say, "Oh, we can reverse that," but no, many times you can't, and it's inspissated in that area, and it just becomes a nightmare when I do their facelift. So what are for the viewer? What is some incredibly great advice from a superb dermatologist like you on kind of knowing before you go when you're going through this, like especially like in the woman who's in their 40s and 50s, when they want to still look their best, but they don't want surgery? What are like the 3 caveats you would tell them? Obviously, besides skincare, for fillers and neuromodulators.
So I think it is important to start, before, if you can, before
Right.
you have permanent lines and deep volume loss. Of
I
course,
agree.
if you start earlier, it's easier to keep correcting it
Right.
over time. But also, it's important as you age to really notice, the areas where you're losing volume and gradually try to rebuild those, so that you're not having to do a lot all at once. And then I think the goal is always to try to look natural and to realize that at some point, regardless of how much neurotoxin or filler, even, resurfacing and tightening of the skin we do, at some point, there may be so much damage that you really do need to go to a surgical option.
Right. Wise words from Dr. Missy Clifton from Bentonville, Arkansas, phenomenal dermatologist. So give us your comments and thoughts on injectables and fillers. I think that the most important thing is go see a true expert that understands the science of aging and that truly can give you really what you want, and also, more importantly, guide you to the right endpoint so you'll look natural. Like Missy kept telling us throughout this whole episode, is that you got to look natural. You can't look different because, as physicians, we're in the face protection, not witness protection program in our patients. So it's really important to keep them looking normal, meaning Homo sapien. So Missy, thank you so much for joining us today. It was phenomenal.
Thank you. I loved it. Thanks for having me.